Everyone, it's Jim McNasby, the General Counsel of Michael J. Fox Foundation and a member of its Patients Council. I was diagnosed with Parkinson's in 2000. Today, we're going to be talking about stress and Parkinson's, why it makes symptoms worse, how it connects to mental health, and what latest research on stress and Parkinson's, and how you can eliminate its harmful effects. Before I introduce our esteemed guests, I need to take care of a few housekeeping details. First, if you have a question, type it in the Q&A near the middle of your screen. The Q&A box, near the middle of your screen. Foundation staff and our panelists will get to as many as we can. There isn't a general chat, so your questions will not appear for everyone else to see. I will share your questions with the panelists throughout the conversation and during the dedicated Q&A session at the end. If you want other helpful information, check out the resource list on your screen. Second, to add closed captions in English, please click the CC button on the bottom right of the media player on your screen. Third, like all of our webinars, this session will be recorded and available to watch on demand. This can be a great resource to share with loved ones who couldn't attend the live event or just rewatch at a later time. The on-demand version has captions available in a few different languages. And finally, if you're experiencing any AV issues, please check the icon on your screen and to make sure you have a strong enough Wi-Fi connection to support the live stream. So we got a lot to discuss today, so let me introduce our panelists. First is Becca Miller, who's a licensed clinical psychologist and associate professor in the Department of Psychiatry at the Yale School of Medicine. She was diagnosed with Parkinson's in 2013 and is a fellow member of the Michael J. Fox Foundation's Patients Council. Welcome, Rebecca.
Thanks, Jim.
Dr. Rick Helmick is a neurologist at Radboud University Medical Center in the Netherlands and is a principal investigator at the Donders Center, leading the System Neurology Group. He researches stress and Parkinson's. Welcome, Rick. And finally, Dr. Amy Hiller, a movement disorder specialist and director of the Northwest Parkinson's Disease Research Education and Clinical Centers at the VA Portland Healthcare System. She's also an associate professor of neurology at Oregon Health and Science University. Welcome, Dr. Hiller, excuse me.
Thank you.
So we have a lot to talk about. The first thing is our stress cycle. Amy, let's start with you. Experiencing stress is a normal part of life. We all know the feeling of being stressed out, but what happens in the body when someone is experiencing stress?
So there's a lot that happens. It's a complicated cycle with many effects. We can have increase in our heart rate. We can have increase in our cortisol levels. In Parkinson's, you may have worsening of some of your symptoms. So there's a number of things that happen during a stress response.
Okay, great. Thanks. Becca, Amy, is there a difference between good stress, like a wedding or travel or birth of a new family member? And does it have the same effects as, quote, bad stress, if there is such a thing for someone?
Yeah. So all stress kind of in the acute phase has kind of similar effects. And we think that's not so bad. That's to be expected. That's a normal response. We should get stressed with things. But what we think of as kind of the bad things that happen is if you stay at that high stress level and you can't come back down. So it's that chronic stress that we think is really the problem. The normal kind of up and down, that's not so bad. And that could happen with good stress, good activities, good things that are happening. But it could also happen with bad things. And then again, kind of the staying stress that could again be from good things or from bad things potentially. And I think it's important to keep in mind that any stress is stress, even when it's a good thing. So, to just think about how you manage that.
Absolutely.
Yeah, and I also think about having no stress is not necessarily a good thing, that you want to have a little stress which it goes along with good things happening, right? You want there to be good things in your life that they may cause a little stress, but then you can recover from it fairly easily, whereas chronic stress can cause more problems.
That makes sense. Okay. Rick, could you walk us, we've got a slide up that shows the stress cycle. Can you walk us through how it works and how the body returns to baseline?
Yeah, so when people are stressed, so what first happens is that there is a surge of a substance called noradrenaline in the brain, and that acts really fast. So it acts within seconds. And what happens is that it pushes your heart rate up, it makes your pupils go wider, and it also has effects on brain areas that are important for some symptoms of Parkinson's disease. For example, the thalamus, which plays a role in tremor. So those are the acute effects. And then after a few minutes, maybe 10 minutes or 15 minutes, cortisol starts to rise. And that has an effect of, say, half an hour or an hour. But after that, if the stress is gone, that cortisol is back to normal. And in people who experience chronic stress, that cortisol doesn't go down again. It stays up. And it might have effects on the brain as well that are not so good.
That makes sense. Okay, so we talked a little bit about the difference between acute and chronic stress. Becca, can I ask you, does chronic stress relate to mental conditions like depression and anxiety? And if it does, how are they different and where do they overlap?
Sure, yeah. I mean, there's some of the same symptoms, like it may affect your sleep. Depression affects sleep. Anxiety can affect sleep. They can, but they don't necessarily, they're not necessarily the same. So depression is more associated with sadness, hopelessness. Anxiety is more agitation, whereas stress can feel like you're kind of more activated. So, and then they all may benefit from something like psychotherapy, but they're different kind of underlying mechanisms. And something like depression and anxiety can also be often fall together. So there's a lot of overlap, but then there are certain specific differences that a mental health professional or someone else can really help you tease out.
I see. Okay, great. Becca, can I ask you specifically about your own experience with Parkinson's and how stress manifests itself with your symptoms?
Yeah, for sure. I mean, I think it goes one of either two ways. It can cause me to have more dyskinesia, that it sort of activates that end, or it can cause my medications not to work as well. So it kind of goes both ways. I don't experience tremor, but I've heard from a lot of people how stress really activates their tremor in a lot of ways. And then there's this kind of cycle of feeling more embarrassed, being more tremulous. And then, so it can be a sort of bad cycle in that way.
Yeah, I think of it in my own experience, I think of it as kind of a vicious cycle because the stress begets worse symptoms, begets more stress, and you just keep going down. And I find myself becoming clumsy with my speaking, with my gestures, with my tremor, which is really well controlled by DBS that I had, 6 years ago. But pronounced different was, when I'm about to do something like talk to a lot of people on the webinar.
Right, exactly.
Or something, I find myself halting and my symptoms become more. So I try to be aware of that and not worry about it because there's not a lot.
Yeah, the self-consciousness can really kick in, and then it is a vicious cycle.
And that's the worst. Yeah, my gosh. Amy, what symptoms or changes do you see in your patients when they're stressed?
Yeah, so some of the things you both already mentioned. So tremor is one that I think for a lot of people really Sometimes I call it people's stressometer, you know, that as soon as their tremor really kicks up, it's like, oh, okay, I'm stressed. And maybe they don't want to think they are, but, you know, that tremor kind of keeps them in check of knowing when they are. Dyskinesias certainly are one that gets worse. Freezing of gait is another one where people kind of have their feet get stuck to the floor and have trouble with walking. Those are kind of the three I would say we think of most commonly as getting worse with stress.
Yeah. Huh. And a question from the audience for you, Amy. Why do my meds seem less effective when I'm stressed?
So it's probably a combination. You know, one, if the symptoms are worse, it's going to be harder to manage the symptoms, right? And then also your metabolism may be going faster when you're stressed and kind of working through those meds, then they may not kind of last as long.
Yeah,
Right,
it often feels like
okay.
I burn through my dopamine faster when I'm
That makes
stressed,
sense.
and then more off periods come.
And Rick, why does stress cause these effects in people living with the disease?
Yeah, that's a great question. So stress has multiple effects on the brain, and one thing. So what you told us and what Amy told us is also what I see, that people experiencing these hyperkinetic movements like tremor or dyskinesias, those are the clearest or most visible effects of stress on people with Parkinson's. And that, I think, is caused by these effects of noradrenaline, which act on motor regions in the brain. And in healthy people and in everyone, basically, that also has a role. Like if you are in stress, you need to act fast, you need to either run away or fight or whatever. So that noradrenaline has an effect on activating those motor regions. And in people with Parkinson's disease, the effect is that things like tremor and dyskinesias, they go up. So that's one thing. And then the other thing is that people with Parkinson's disease experience often that the things that should normally go automatically don't go automatically anymore. So you have to more consciously think about, things that you are doing. And that requires extra effort of several brain regions. And that is something that we call compensation. So the healthy part of the brain compensates for those difficulties with doing automatic things. And what stress does is it basically wipes away these compensatory mechanisms. And that is why a lot of other problems that patients experience become worse when they are stressed.
That makes sense. Okay, Amy, question for you if I can. How does PTSD or CPTSD relate to this? Does a history of PTSD have an impact on developing Parkinson's?
Yeah, so I think some of this is a little bit of a question. So PTSD is post-traumatic stress disorder, certainly something we see commonly within the VA system. And we actually have researchers here who've been looking at this, and it does seem like it's an increased risk factor for developing Parkinson's disease. This was looking at a big data set. So I think, there's always questions on that type of data. Is it fully good data? Also, are people who experience PTSD more likely to have had head traumas? There's other things that go along with that. But it does look like there might be a suggestion that PTSD is a risk factor for developing Parkinson's, but it's hard to say that for sure.
Yeah, that makes sense. Okay. Becca, we've been talking a while about physical responses to Parkinson's and stress, or stress and Parkinson's, I should say. What about your non-motor symptoms? Is there any effect on those?
Yeah, I think definitely sleep, which is, not uncommon for anyone when they're stressed to have more sleep problems. But certainly with Parkinson's, I already have trouble staying asleep. So it definitely affects that. And also then like my executive functioning, like being able to plan and carry out things, that kind of feels like when I'm stressed, it's much harder for me to to do things like that.
Yeah, I'm thinking about my own experience, and my own experience was at a time in my life where I was very young and ambitious lawyer, and I got this heavy diagnosis when I was 31, and my stress level was off the charts. It took me a while to realize that that my symptoms were in part being worsened by the combination of stress and Parkinson's, and it really kind of led me to be afraid and led me to think my prognosis or my diagnosis path was going to be much worse than it's actually been. So, so I've made some changes over time to reduce that, but that concentration of the two things together is very, is very consequential and very something that can be difficult to deal with.
For sure.
Rick, a frequent audience question that we're seeing right now is whether or not stress actually causes Parkinson's, as many people are diagnosed like I was at a particularly stressful point in their life. So what's the cause and effect relationship?
Yeah, that's a great question. So many people indeed experience, and I've also had multiple patients that were diagnosed after a very stressful event. So I had one woman who developed her first tremor the day after her husband experienced a severe heart attack, and another patient who developed or noticed her first tremor while she was at her mother's funeral, or people who experience their first symptoms like tremor when they recover from anesthesia after surgery. And these are a lot of stories. And many people tend to think that this event indeed caused Parkinson's. I don't think that is the case. And the reason is that Parkinson's disease already affects the brain 5 to 10 years before the very first symptoms emerge. So there's a very long period in which Parkinson's disease is already present in the brain, but it doesn't cause symptoms. And that is because these compensatory mechanisms are in place in the brain to prevent these symptoms. And when a very, very stressful event occurs, those compensatory mechanisms are transiently wiped away, and the Parkinson's disease is unmasked. So it shows itself. But that doesn't mean that the stress caused it. It just means that it became visible at that time.
Right. I mean, you move from prodromal to visibly symptomatic. Right. That makes sense.
Yes, exactly. Yeah.
Right. So we're just sticking with you for a second. Is the physical stress of something like a big race or a marathon bad for people with PD?
No, it's certainly not bad. So we know that exercise is actually very good for people with Parkinson's. So we did one study here in the Netherlands where people with Parkinson's disease were asked to exercise on a home trainer for 45 minutes 3 times a week for half a year. And after those 6 months, the people who did that were not progressing, whereas a control group who did not do that progressed over time. And we also saw on brain scans that those people who exercised had less loss of gray matter than those who did not exercise. So exercise is actually good. What is now also becoming clear is that there are some people who over-exercise, so who exercise so much that they have trouble recovering from that exercise. And that is not good. But regular exercise, whatever people like, could be swimming, it could be running, it could be just walking, that is actually good.
So that's a sort of a form of the good stress that Becca was talking about. That's great.
Exactly. Yeah.
All right.
Exactly.
Another question for you, Rick, is how do stress and brain fog intersect? This loss of executive function type issue.
Yeah, so brain fog is difficult. It's a difficult definition because different people might mean different things when they speak about brain fog. But usually people say that in the context of fatigue and difficulty to focus or concentrate. And these are symptoms that regularly occur in people with chronic stress. So people who have chronic stress experience symptoms of anxiety and depression, and also fatigue and difficulties concentrating. So these two are very, very closely connected, I think.
Hmm. And Amy, do you see those kind of issues with your patients?
Definitely. Yeah. And I think you guys both brought that up today, that it's hard to focus and kind of get the words out. And I think even those of us who don't have Parkinson's have had that experience, right? Of you're nervous and giving a lecture and a question comes up and all of a sudden you're like, I don't know my name. How can I answer this question? So I think some of that, all of us can experience, but I think it's intensified certainly when someone has Parkinson's, and often executive function is affected by Parkinson's specifically.
Absolutely. And the other thing about stress is that it can impact your care partner too. So for all those care partners listening, thank you for all that you do. But I mean, we all need to recognize that stress affects care partners. I think of my own situation where my partner is, put in difficult positions by me because I have, for example, RBD, and he, is very stressed out because of that, and with good reason, because no one should have to, deal with that. But it's complicated. Amy, do you hear stories about stress impacting care partners as well as the person living with the disease?
Yeah, and it's not always the partners experiencing it the same way, right? I think there's some Parkinson's patients who are very stressed and their care partner might not be so stressed. And then sometimes I see the opposite. I do a palliative care clinic for movement disorders, and we kind of are amazed because it's quite common that we'll have a patient come in with, moderate to advanced disease, and we ask them about how they're kind of functioning and managing, and their quality of life is quite good, their mood's quite good, and then their care partner will be completely stressed and feeling like they're kind of having to take everything on. So I think it varies by individual, but certainly it's quite common in care partners that we see stress, and that they need to get their own help for that. You can't take care of someone else or help someone else out if you're not taking care of yourself. So that's really critical.
Yeah. And Becca, does that impact the relationship that you have with your daughter?
Yeah, it does, certainly. I mean, I think since I've gotten DBS, since my deep brain stimulation surgery, it's been much better. But I think it used to be really a point of stress for us that I wouldn't be able to be reliable enough for her to go take her places, take her to a birthday party or something like that. I couldn't, the predictability of my symptoms was much less. So that was really, I think, stressful for both of us. We talk about the enemy being Parkinson's and kind of gang up on Parkinson's as opposed to trying to fight with each other. But yeah, it is. It definitely causes stress.
Absolutely. And can you say, Becca, a little bit more about how to tell if it's stress, what that someone is experiencing, or whether it's just nervousness or anxiety? Can you help sort through those a little bit?
Yeah, it's not always that easy to tell the difference. I think that, one thing with stress or chronic stress is that you can often identify kind of an event or a situation, whereas anxiety seem to come out of nowhere. But I think that, figuring out if it's something that's lasting for a period of time and really affecting your functioning, that it's maybe time to go get some help from a mental health professional who can really help you sort through those things. I mean, sort of the good news is that some of the same things that help with stress and will also help with anxiety or depression. So things like exercise, moving, talk therapy, all those kinds of things are all good for those conditions.
That's great. Good. Okay, let's talk a little bit about researching stress. Amy, what makes stress difficult to study?
Lots of things. One of it is kind of measuring, what stress people are experiencing, right? Also, we said it's kind of individual, that what stresses someone else out, one person out may not stress another person out. The effects may be short-lived. It's difficult in Parkinson's in general if we don't have wonderful biomarkers to follow things over time. So there's lots of complicating factors that make it a difficult area of study. It's not something where, you think about like a medication trial, right? And you give someone a placebo and then you give someone else a pill with the active drug. You can't kind of give someone no stress and give someone else stress, right? But I think Rick can maybe talk about the work he's doing to try to give people stress reductions and then kind of see what the effect is. And I think those things are really promising areas of research.
Yeah, and Rick, go ahead and do that.
Yeah, great. Yeah, so what you're saying, Amy, is completely true. I completely agree with that. So one of the difficulties with stress is indeed that there's no perfect biomarker to measure how much stress someone has in their body. And the other thing indeed is that it's difficult to put people under stress. That's not ethical. So what we are doing here is to do the opposite. So to have one group of patients who undergo a mindfulness-based stress reduction intervention that lasts 8 weeks. So it's pretty intense. It's about 2.5 hours per week in a group. And one other group that are, getting the treatment as usual. And then what we are doing is testing whether that intervention has effects not only on the symptoms that people have, like anxiety and depression, and also motor symptoms, but also how it affects their brain. So we do imaging before and after, and we see, if we follow them up after a year, how long lasting these effects are of that mindfulness intervention. And one, cool biomarker we are using there is to look at cortisol in hair. So we cut a little bit of people's hair before and after a year, and cortisol builds up in hair. So the degree of how much cortisol you have in your hair tells us something about how stressed you have been over the past few months. So together with also the brain scans, we try to understand how stress reduction influences the brain and how it influences these chronic cortisol levels in people with Parkinson's. And of course, we hope that mindfulness not only improves the symptoms of Parkinson's disease, but also that it might have long-lasting beneficial effects on the brain.
That's very important. Huh. Okay. Just a quick note. When I was talking about my own experience, I used the word or the initials RBD. Just to clarify for the audience, what that is in short REM sleep disorder. And the doctors can correct me on this one if I've got it wrong, which is everybody but me. So I'll answer. But it's a symptom of Parkinson's. Normally, it's a precursor for Parkinson's, but can be a symptom of Parkinson's where when you sleep, your body, when it's in REM sleep, paralyzes itself. And when you have RBD, your body loses the ability to paralyze itself. And so you act out your dreams. And dreams are often, for me, are often very negative. like, a shark coming after me as I'm in the water, this kind of thing. And then I act it out. And so I thrash around, and that's embarrassing and painful and can be dangerous for anybody with you. So, okay, so sorry that I went on about that. And Rick, is the research that you're doing beginning to show how stress affects the dopaminergic system?
Yes, at least that's what we're trying. So what we are doing with these MRI scans is also collect data on the integrity of the dopamine cells in the substantia nigra. We don't have these findings yet. So the last week, the 124th patient and the last patient was included in that study, and we will need some time to look at the data. But what we know from other research is what acute stress does is it squeezes the last drops of dopamine out of the striatum. And that is because when people are stressed, like I told you about the noradrenaline, you need to move fast, usually. And dopamine also helps to move flexibly. So in that sense, you can understand that acute stress increases dopamine and also increases noradrenaline. But in people with Parkinson's disease, the dopamine system is already at their maximum effort of squeezing dopamine out of their system. So what stress does is it overloads the dopamine system. And that is probably one reason why medication is less effective when you are stressed. You need more dopamine to cope with the stress and all the symptoms that people have.
Right. Okay. Well, we've talked a lot.
Sorry, maybe to add. So what we don't understand well enough yet is what the long-term effects are of stress on the dopamine system. So if people who have long, over years stress, if that has a negative effect on their dopamine cells. There are some animal studies that point in that direction, but there's no evidence at all in humans. So that is something we need to understand.
Yeah, that's important. So Amy, what research is going on to validate strategies to reduce the impact of stress? I know measurement is challenging, but what can we look forward to hearing results about?
Yeah, so I think Rick's study is, one of the most exciting, thinking about mindfulness. I think I don't know of all the active studies that are going on because it's often hard to find out about them until results come along. But I think other things that have been thought about in addition to mindfulness or exercise intervention, yoga interventions, management of depression and anxiety symptoms, all those things are potential things that could benefit stress and have positive effects.
That's great. Rick, did you want to weigh in on that question too, about what strategies are validating strategies to reduce stress?
Yeah, I think there are multiple strategies. So, like Amy said, exercise can be good. Mindfulness can be good, I think, but it's probably not for everyone. So, and then there are also things like social support and social interactions that are also really important for managing stress. So just to give you an example, during the COVID pandemic, which was a very stressful event for many people, we had a longitudinal cohort of Parkinson's patients that we followed here in the Netherlands. And we also asked them during the pandemic, so in the first 6 months, to fill out questionnaires on how stressed they were repeatedly. And what we found is that those people who were very stressed were not the ones who had more severe Parkinson's. They were not the ones who had more or less levodopa. They were the people who experienced less social support from others, and they were people who had more difficulties with cognitive function. So I think these things could also help. Well, recognizing these things could also help to reduce stress in people.
Okay, that's great. Becca, can I talk to you about a bit about your own experience of managing stress? What works best for you when you're managing or attempting to manage the stress of your job? You're a professor at Yale. You're a mother. You got a lot going on. What do you do to manage
for
stress?
Sure. I think one thing that really helps me is just remembering to take things one day at a time, 1 minute at a time. Sometimes just trying to like reorient to that, and I use strategies from cognitive behavioral therapy, like my own training as a therapist. I use for myself basically cognitive behavioral therapy strategies, like asking myself, well, what's the worst thing that can happen here? Kind of trying to reorient to like that it's not as bad. And then also using acceptance and commitment therapy strategies. There's a great book called Get Out of Your Mind and Into Your Life that is like a workbook for that people can use that has a lot of strategies to kind of, I don't know, those kinds of techniques and strategies help me a lot. And then also just, there's always someone awake in the Parkinson's community online. So any time of day or night, it may be in another country, but there's always someone I can find on Facebook or through a group chat that will be there that I can kind of, that kind of peer support, just getting support from someone else who's out there and dealing with the same kind of thing.
Absolutely. I myself find that support groups are terrific, because if you can talk about, at least for me, if you can talk and share your feelings, it's validating, first of all. But it also it's like a pressure reliever. It's like somebody dialed down the impact of what's happening. You feel like you get something off your chest, and there's almost a relief that comes from that, which I think is really terrific. I'm also a huge proponent of exercise. I exercise every day. It doesn't have to be something, tremendous. It doesn't have to be a 5-mile run. It can just be a walk or a dedicated time to stretch or something like that. And I highly recommend that, just because it allows you to kind of, if you can put it together with some mindfulness, some quiet time, and, just say, I need 15 minutes for myself right now, that kind of thing is really important and impactful. So, Amy, what do you recommend to your patients who are dealing with stress? I know exercise is one thing we talked about, a little bit about mindfulness, and we can say a word about that, but are there also medication options available?
Yeah, so I think for stress itself, we don't often think about medications as kind of being the right way. But if there's stress and anxiety or stress and depression, and as Becca talked about, these often overlap and they often are coexistent. So I think certainly it's worthwhile to talk with your neurology provider, potentially work with a mental health provider to think about medications for managing these things if they're present. And I think around, mindfulness is one particular approach, but the mind-body therapies in general often have a lot of similar threads there. And, I think in yoga, my understanding, I'm not a yoga expert by any stretch, but is that you do the physical so then you can quiet the mind, so that the two kind of work together in tandem. And I think other forms of meditation also can be something that's helpful. And I think it's also important that people find what works for them, right? So if There's some people who don't feel comfortable in support groups, and that isn't, it's anxiety provoking for them to be in a group and present things. So maybe something like an anonymous group chat is a much better, means for them to communicate. So I think knowing that there's lots of options out there and trying to find what fits with the person. I think, again, those connections, be it in your community through a support group or be it other connections that you can make, are also really, really critical.
That's great. Yeah, encouraging people to explore options that are tailored to their experience is super important, I think. So, Rick, we've been talking a bit about movement, yoga, and all that. What does exercise and movement do in the body to reduce the effects of stress?
Yeah, that's a $1 million question. So I think exercise and things like meditation, they probably work well in Parkinson's disease because they have multiple effects. So Parkinson's disease is a very complex disorder where many different systems are, well, regulated in a different way. So in that sense, it might also be, difficult to understand if one single pill would completely solve all of that. So for a complex disorder, we need a complex intervention, and exercise and mindfulness-based stress reduction are complex interventions. So they have multiple effects on the body. And one of these effects are, for example, that exercise and also mindfulness, they reduce the inflammation in your body. So the studies have shown that people who regularly exercise or do mindfulness have lower values of substances like CRP or interleukins that are, signal molecules for inflammation. And so that might be one effect. And then there's also studies looking into a substance called irisin, which is released when people exercise, and which also has beneficial effects onto the brain. So it would be great if we could really understand what single substance is so important in mediating these beneficial effects of exercise or other lifestyle interventions, so that we can use that knowledge to create a drug to boost these effects. But I wonder if it is really that simple, because it has so many effects on the body.
It makes perfect sense. Huh. Now, Amy, we've mentioned mindfulness a couple of times in the answers, but I didn't ask, what does it mean, mindfulness? And how can people incorporate it into their lives?
Yeah, so that's another tough question. There's a number of tough questions today. I think there was a Time article that came out years ago called The Muddied Meaning of Mindfulness, because I think it does vary. There's these very structured programs like mindfulness-based stress reductions, which I think especially for like a research study are a great option because they're very regimented. They follow kind of a typical pathway. And the focus is really getting you to notice when you're feeling stressed and then trying to kind of move away from that so you don't get into this chronic stress cycle. So I think there can be, taking courses like that can be super helpful to get you to kind of understand what mindfulness is. John Kabat-Zinn was one of the big early proponents of mindfulness-based stress reduction. And one thing I really liked that he said was, when you're in the shower, just be in the shower. So don't be at work, don't be making dinner, don't be driving the car, just be in the shower and enjoy the moment. So I think that's kind of the overall, is try to be in the moment, not thinking about 27 other things, because all that adds so much stress to life. And again, there's these kind of structured programs, and then there's a lot of things that I think there's a lot of things in cognitive behavioral therapy that have similarities, and other types of therapies that kind of take things from it. And I think if people find something that helps them, I don't think it needs to have this name or that name. You know, they can all have some positive effects.
That reminds me of a personal experience that I had with once somebody asked me this question is, how do you live your life? In the past, present, or future, allocate a percentage. And at the time I was very young, and my answer was 10, 20, 70. It was where I was coming from. I'm doing what I'm doing, but I'm going somewhere. And now with a little more gray hair, driven by the amount of cortisol I have, I answer 10, 80, 10, because I have a sense of where I've been, but I'm living in the moment, and I have a sense of where I want to, be now or 6 months from now. But keeping that reasonable, but that shift in the data for me was a very interesting exercise, and I think is related to mindfulness. Becca, I want to take advantage of your expertise for 1 second in psychiatry. When should someone seek professional help for their mental health when dealing with stress, and what does that look like?
Well, certainly. I mean, I think if someone's feeling so overwhelmed that they're feeling like they wanting to hurt themselves or kind of take their own life, that's certainly an emergency that someone should definitely seek mental health care as soon as possible. Go to the ER, call 911, those kinds of things. That's a clear-cut thing. I think I am of the notion that everyone should have a therapist, would benefit from a therapist, regardless of PD, no PD, stress, no stress kind of thing. But I think that, it's not as accessible as it should be in our country right now to get mental health care, to find a therapist. But I think if you can, and I encourage it, to find a therapist who may not specialize in PD. I don't think there are a lot of people who do, but if you find someone who you like and can build a good relationship with, you can help them to learn more about PD. And the relationship with your therapist is the number one kind of factor that determines good outcomes. So less so than how they're specifically working, what kind of treatment they're giving you, but really,
I sort of see it as an independent search, right? An independent to find somebody who can help you in your situation, not somebody who's a PD stress specialist.
Right. I mean, if you find one, that's great, but there are so many out there. I think also, when talking about stress, is thinking about, like, are there things in your life that you need to change, like quitting the job or changing are you in a relationship that's causing you so much stress that it's not one you want to be in anymore? Like, looking at the context too for yourself. And that may be something that you do with a mental health professional as well, but that can also be something, because it can be just a big indicator of something going wrong that you can change.
Right. That makes sense. Okay. All right. Well, it's 10:48. We've got about 10 minutes or 12 minutes left, and we've got a lot of audience questions. So the first one, which we have quite a few on, relate to diet, nutrition, and stress. So maybe, Rick, you could go first on that and tell us what, is there any relationship that, is there any link between diet, nutrition, and stress, or how does that work?
Yeah, that's a very interesting field. So there is a gut is the gut, and there are a lot of neurons in our gut. So that is not surprising per se.
I'm getting a little technical trouble on my end. Okay, Rick, Amy, maybe do you have a view about nutrition and stress?
Yeah, I don't know the literature super well. I think there often, there are some nutritional foods that are thought to be less kind of inflammatory, like Rick was talking about before. So it would make sense to
That's
me.
what most studies suggest.
Rick, you were coming in and out a little bit, so you might want to just recap. We lost you a little bit.
Oh, I'm sorry about that.
Oh, no worries.
So, can everybody hear me now?
Yeah, we can. Yeah, you just went out for a minute there. So you were saying that the gut is a place where neurons can be discovered, and then we lost you.
I see. Yes. So what I was saying is that there are a lot of neurons also in the gut. So the brain and the gut, they communicate. And if people are stressed, that might influence the gut. They might experience constipation and the other way around. There are not a lot of good studies into nutrition and diet and the effects on Parkinson's. What the studies that there are seem to show is that a Mediterranean diet, so lots of vegetables, lots of fibers, are good for improving your gut health, and that might also have an effect on stress and motor symptoms.
Okay, great. A question from the audience, and anybody can weigh in on this one. Traveling abroad is a big issue and always gets my husband stressed. How can we make it easier for him? So I can start on that one, which is, a plane can be an awkward thing to get on and off and try to have an aisle seat. It's just easier to maneuver for, put the person with Parkinson's there. I try not to have too many pieces of things that I'm carrying with me, like check a bag instead of carry on, because, if you're going to you should carry the fewest number of things you need to manage. But, if traveling is a source of stress, then ask yourself if it's a trip you need to take, and so, sometimes it's unavoidable, but sometimes you can make the choice to find a substitute. I would say that. Does anybody else have a view about traveling and Parkinson's?
I can make a couple comments. I'll often tell people to do a trial run, find a hotel that's close by and just do a night in the hotel and see how it goes, especially like some of the chains, the hotels actually look exactly the same. Another tip I heard from a caregiver, which I thought was amazing, was they were going to a different town and she got in touch with the local support group and hired a caregiver for a couple of days while they were there. So they just kind of had an extra buffer, which I thought was such a brilliant idea. Because I think especially if you're changing time zones where, it's exhausting when you don't have Parkinson's. And then when you've got to take your meds very regularly. And, I think thinking about just kind of having some extra supports to make the process easier can be helpful.
Yeah, one of the things that I do is really try and build in extra time and make sure that I am I start packing pretty early so that it's not so stressful, that I'm like thinking it through. And then I just I'm not building in a really tight schedule, like kind of leaving myself space to recover. And then there's a lanyard and badge you can get called the Hidden Disabilities Sunflower that I've heard other people have had good experiences with, because sometimes with Parkinson's, we don't always look like there's something going on, but we can really experience some tough times with gait, etc. But this is something you can go online and get. It's the hdsunflower.com. That it's a free service, or maybe a couple dollars. They'll send you like a card on a lanyard that you can wear, and this is supposed to be an international symbol of a hidden disability. So they're going to help you kind of help folks at the airport recognize that you may need some extra time getting on the plane, for example. So I've had friends who've had good luck with that.
That's interesting. I hadn't heard of that. It's new to me. It sounds like an interesting thing to explore. Another question from the audience: what about marijuana use? Does it help with stress or make it worse, or what's your feeling on that? I'll ask Amy first.
So that's another thing where there's just not a lot of research and it's hard to do research. So I think, some of it's the individual. Certainly, I feel like some people who are chronic users can really damage themselves in terms of cognition and can make life just more stressful, and can also kind of get a rebound anxiety. I think there are some people who've told me, they use small amounts for sleep and find that to be really beneficial. But the research is really tough again, because there's all different kind of formulations and different components and makeup. And then, many places it's not legal, or at least it's not federally funded to do research. I'm not sure within the Netherlands if there's been more done and there's more information there.
Right. Okay. Becca, on finding community support that Amy talked about, what do you use the buddy network, or how do you find community support?
I think there's so many different ways depending on what works for you. I find a lot of my support through Facebook, honestly, like different groups on Facebook and online. There are local area support groups that I know of and attend on occasion. I think looking at your local area agency on aging can be helpful. The buddy network, there's lots. Online is a huge way of communicating with others, and that you can find people all over the country, all over the world, really. So you can have people in different time zones, which can be helpful in the middle of the night.
Yeah, absolutely. So, and just a plug, I try to use the buddy network as I can, but it's a great resource. It's offered by the foundation, and something that I'd encourage everyone to use. So, time maybe for one more question. Any advice for caregivers? And I'll let all three of you answer that. Maybe start with you, Amy.
Sure. I think, we talked about, Becca said something about think about the things that cause you stress, and is there a way to get rid of those? I think for caregivers, that's really huge. Are there people that you can hire to do certain things? Are you living in a, very large house with stairs that makes it tough for your partner to get up and down? Or, are there ways you can simplify life and make things easier on yourself? And I think to not feel guilty about those changes, but really take advantage of those changes so that you can kind of get some things off your plate, because oftentimes it overflows.
Great, good. Becca, to you?
Yeah, I think you can't pour from an empty cup is a phrase I saw recently, which is so important. I think, oftentimes it can feel like the focus is all on the person with PD, but that the caregiver needs, to have time for themselves and to really focus on their own mental health and wellness, and just to take that time is so important.
Absolutely. And Rick, from you, any wisdom for caregivers?
Yeah, I think it's really important that that the system, so the caregiver and the patient are both in balance. So I guess my main advice would be to speak to each other about what causes stress, not only in the person living with Parkinson's, but also in the caregiver. We sometimes have shared sessions where a psychotherapist, for example, speaks to both the caregiver and the patient. So that might sometimes work. And shame is often a big thing that creates this vicious circle. So sometimes it can also really help to explain to the people around you, or even in a restaurant, why you're having tremor, and try to break that cycle of shame and stress and more symptoms, and ultimately preventing to do stuff.
Absolutely, it makes sense. Okay, thank you all for those answers. And I would just conclude by saying to all the caregivers listening, thank you for doing everything that you do, because all of us who have this scourge, depend on you for everything. And so thank you, thank you. So thank you for being part of our community and for joining us today. Thanks to our expert panelists for your wisdom, for your insight, and for sharing your time and expertise. We will be sending a link to the webinar on demand to watch again, and you can share it with anybody you like. And we hope you found today's discussion helpful. Thank you, and have a great day.